So, in theory, at least, I've gotten to 11:30 with you, and it's a great pleasure to be here at this event. It's a really exciting program, and it's really nice to be part of it. And at least from my point of view, you can judge yourselves later. It's a good fit. The topic of this event, of this 3 days, with the work that we've been doing for some 10, maybe 12 years now, with my team and colleagues in Swansea University. And I want to spend this time with you talking principally about SAIL Databank. And I'll tell you a little bit about what it is, how it works, what it's for, and a few examples of what it's been doing over recent years and what we've been able to sort of spin off from it over that 10-year period. But I also want you to bear in mind that it's, which I hope will become obvious as we move through this, it's an organisation, a system which is there to help. So if any of you come from organisations that have data that you're interested in sharing, that you think has useful research attributes that you'd like to see how we could help in some way, please do not hesitate to contact us. We'll be delighted to have a discussion with you. There are a variety of ways in which we have been working with organisations across the public sector and the third sector, charities as well. As some of those will become evident as we move through. Okay, so SAIL Databank. Let's go. So the first thing I think probably just to state the obvious that not all data is the same. So there's a lot of data now in this 21st century. I mean, weather system forecasting produces enormous amounts of data on an hourly basis, and of course that's incredibly useful for public good, as is data about traffic and transport, data about the cosmos, astronomical data, data about the stock market. I mean, you can go on and on. And all of these data sets, all of these activities analysing these data are clearly have huge potential for public good. But amongst all of these myriad of data, there is data about people like you and I. And so from here on in, although we sometimes touch on these other data sets themselves, our principal focus, our principal interest, and I suspect indeed yours, is about data about people. So I come from a group we call ourselves Population Data Science at Swansea University, and within that, the SAIL Databank team exists. And we are focused on quite a particular thing, really. We are all about safely and securely using routine data that's been collected about people to help and improve public services and people's lives. And routine data, and I'll use the phrase a few times, refers to the sort of data that is typically captured by an organisation as it goes about its normal business. So if you're a hospital, that might be a medical record, or a GP, that might be a medical record. If you're a social services department, that might be the records of your clients or service users. If you're a police force or a justice system, it might be those people that go to the courts or come in contact with the police and so on. You understand. So this is very much focused, at least at its core, about these data which are typically and routinely collected by organisations in order to support their own business requirements. And of course, these data have potential beyond those original specific business requirements. That's our proposition, I guess I would say. But of course, it's data about real people. It's data about you and your mother and your sister and your children and me and mine. So it's potentially very sensitive. And so if we are thinking about using this data for purposes beyond its original intent, protecting individuals' privacy becomes the number one priority. Not just because there are some strong laws that protect people's privacy, quite rightly saying, but actually it's the right thing to do, even if you can find a legal way of doing of jeopardizing someone's privacy. Why would you do that? So really very important focus of the work, but and it's difficult. It's really difficult to do that, to protect people's privacy and their interests, while still unlocking the potential of the data that they public service organisations particularly, but I include here sort of voluntary sector organisations and inter-sector organisations. But this data about real people who live real lives, when collected and used at scale at a population level, have an enormous potential for informing us all about the way society works, for the good bits and the bad bits, and gives those people who are able to make decisions about intervening in that society, improving things, the chance of doing the right thing and knowing when perhaps sometimes they've done the wrong thing, because the data can tell them. And we are now in a world where data analytics and has caught up with the challenges that these data might face. And so it is perfectly possible, and has been for some years, to be able to analyse simultaneously really, really complicated data sets, millions and millions of people at once, looking for those important signals from not individual records, but hundreds, thousands, millions of records that can tell us what's going on. And we can do that now with care and precision without jeopardizing the privacy of any given individual. So we believe that data about people is super special, and it needs to be treated with great care and processed really thoughtfully. We know that data about people is hugely potent and has enormous benefits. And we also know that data from a single organisation, no matter how big or comprehensive it is, like a big governmental department or something, that's very, very useful for secondary use purposes, for research and similar analytics. But when you link those data together with data from other organisations, it becomes exponentially more useful. Because let's face it, we all live rich and complicated lives, and our interactions with public services are only captured a sliver of us, according to the interest and needs of that organisation. And so linking data together about an individual, safely, securely, anonymously, so that we build up this kind of rich picture from the data about people that live in society, is the way in which we get the maximum benefit from everybody's efforts collecting that data in the first place. And it's important that that work, if we're truly to understand how society works and how to improve it is at a whole population level. So we study everybody, not just a few that have happened to present it themselves for a research study or so forth. So this is the advantage of data linkage, is that we can build up pictures of absolutely everybody in a population and start to understand what's going on. And we would believe that actually, given that most of this data collection has been funded by the public purse in some way, either through taxation or donation or any number of other means, it seems unethical that we allow this data to sit there and not deliver the full benefit to the public that we can extract from it. And I guess our role in all of this is to try and enable that, to leverage the maximum public benefit from data that's already being collected for other purposes. So we know that this is not easy. Data about people is scattered across countless organisations, and it's not hard to list all of those interactions that people and citizens have with public services. Lots and lots of different. Almost always, these data are completely siloed and never touch each other. All recording important but kind of limited information about an individual. We know that historically, and still to this day, even though it's getting easier, persuading organisations to share their data in a kind of magnanimous gesture can be very hard, and there's a whole bunch of reasons why that's difficult. This is our day job in many ways, is working with organisations and helping them understand that it's safe and indeed the right thing to do to share data. So we know that's difficult. We know that in order to be able to give those organisations the comfort they need to be able to let their data go, and also to be able to look the public in the eye and say, we're doing a good thing here and we're not putting anybody at risk. You need to do a lot of work to make sure you're in really, really good shape as an organisation to do that. And the last 10 or 12 years has been involved with my team and in Swansea and elsewhere around the UK, really getting that right, so that we can look the public in the eye and convince data owners that there isn't any risk to them or their service users from sharing data. We also have routine data, as I shall continue to call it. It is not research data. In other words, it's not perfect data that people have spent ages making sure is absolutely right, is collected with enormous precision against fantastically robust standards. It's the byproduct of organisations doing their day job. And as such, it's kind of what it is, really. Sometimes it's a bit scruffy, sometimes it's a bit missing, sometimes it changes over time, sometimes it's a bit inexplicable. I mean, that's fine. That's how the world works. And if you're in this world, which we have been for a long time, one needs to understand how to accommodate the fact that these data is not going to be perfect in many ways. Data linkage helps. Data curation work that we would do on data helps too, and using analytical approaches that account for the fact that data is not perfect or necessarily complete is also important. But it's important that we don't forget that this is not a perfect world. So what is the SAIL Databank? Well, SAIL does stand for Secure Anonymised Information Linkage Databank, although we very rarely unpack the acronym, but it does have a history. It's a professional, single-purpose organisation. We're based inside a university, so it's like a sort of mini not-for-profit enterprise working inside a university context. And it doesn't have an agenda. I mean, it doesn't have a research focus particularly. It certainly doesn't have any of its own data. It has a single purpose, and that is to work with organisations across the UK to help them safely, securely let their data to be used for research, to be able to leverage the maximum benefit for the public out of it. Often that accrues benefits to those organisations that don't donate their data, but not necessarily so. So we have spent 12 years trying to be as good as it is possible to be at assuring safety and privacy protection, but only so that we can deliver research benefits of analysts from both government, private sector and public sector and from academia who want to have important public spirited questions to ask of the data. We only do all this really hard work about assuring safety so that those questions can be asked of the data and the answers can go out into society and make a difference. It's open access, so it's not our little precious thing that we do for our own little research group to write lots of rather dull, tedious papers in arcane journals. This is an open access environment, so any bona fide researcher or analyst who have got the credentials to prove it can apply to access the data in SAIL, can propose a project, and it goes through a scrutiny and approvals process. But provided it's a public spirited project and it's got good people working on it from wherever they come, they can get access to the data and do their project. I'll tell you a bit more about that in a minute. And we're open to any data custodian, any organisation that has data that they think would make a contribution to share their data into the SAIL Databank too. And I'll say very briefly what that might mean, but I'm not going to go into great detail today in this interest of time. So I mentioned before, we've been around a while. We've been in operation about 12 years now, which is quite a long time in these days. And when we first started, there was no such thing as an organisation like us. I think we're still pretty rare internationally. We started our work we're up from Swansea University, which is in Wales, and we started our work focused on the health data of Wales, simply because it was proximal. It was close to us, we knew it, we started working, assembling bringing in different data sets from different places, and very importantly, linking them together. Over time, I'll come back to the data linkage thing. Over time, we extended that work to data that's beyond health, but relating to the same individuals, the people of Wales, including schools and other forms of education, social services, housing, and so forth. So starting to build a richer picture of the people of Wales. And for the last 5 or 6, 7 years, we've been doing more than working solely in Wales. I suppose we have the richest data sets relating to the population of Wales, but we have plenty of other data that are linked together from pan-UK often. And we're providing data banking services right across the UK. There are lots of different initiatives. I'll touch on one or two of them by the end of this talk, I hope. And we're doing that through multiple partnerships and initiatives. As I said, I'll talk about those. So from here on in, I will refer to SAIL Databank as a trusted research environment. This is a kind of relatively newly coined term, which seeks to kind of conceptualize the sort of entity that SAIL is, although it is, as I mentioned before, slightly unique in that it's totally independent and totally open. There's been a lot written about how to build trusted research environments that are truly trustworthy, and colleagues in the ONS some years ago published something called 5 Safes, which gives you a sort of a simple way of thinking about how a trusted research environment should organize its activities in order that it can be demonstrably improved. It's safe, so you need safe people, you need safe projects, you need safe settings, you need safe data, and you need safe outputs. And by the end of this talk, you will see that I'm giving you a sense of how we go around organizing those kind of things. But it is, again, worth mentioning that we are fundamentally, wherever we possibly can, about data linkage. This is a thing. And I make no apologies now for putting on this being a really very old slide. One of the very first ones we produced in SAIL, where we showed for the very first time, this is incidentally a year in slightly synthesized year in the life of a little old lady, with data sets that have been extracted from general practice, from social services, and from hospitals. And if behind each of those dots, there's actual data, but it gives, for the first time, a visualization that you can construct a longitudinal history of an individual, constructed from lots of different data sets that have come from lots of different organizations. And that's what we do. Of course, what we do now is the list of data sets and organizations, as it were on the left-hand side, are loads, dozens and dozens and dozens and dozens and dozens. And the duration, at least of the population of Wales, goes back about 30 years. So you can see that's a huge amount of data, and for interested projects, interacting with that is vital. So just to give you that sense, data linkage is the thing that unlocks the story, the real story, the truth about what's going on. If you are interested in our story, the SAIL Databank story, clearly we haven't jumped to being a pretty effective organisation in this space from zero to now. It's been incremental, and that path has been hard, right? It's not been easy, and it's been slow in some ways. But there is, if you go on our website, you can find a kind of, a couple of years ago, we wrote a sort of 10-year retrospective you can look at it if you're interested in our past. It's there for you to have a look at. So where are we now? Well, at the moment, we make an offering of 48 core data sets. These are ones that are available to anybody to access with due permissions, of course. And they're all linked together. There's, I think it's over 60 billion records in the archive now, which is a lot. There are, I think as of last week, there were 286 projects that were being run on that data by researchers and analysts from across the UK, and there's close to 600, or approaching 600 of those people, registered users, interacting. I'll go on to say that users have to log into our systems to get access to this data. And we've got well over 500, if not, it's approaching 600 data sharing agreements in place. And just that, what that means is there are 600 different organisations, close to 600 different organisations around the UK who have signed on the dotted line a data sharing agreement, which under which data comes from them to us to be curated, to be linked, to be reused. So that's, you know, we're busy. There's a lot going on, and we've got our own governance and legal team that support that. And at the moment, I think at least we're very well accredited and externally audited and inspected. So I think we're the only ISO 27001 NHS and Governmental Digital Economy Act accredited TRE in the UK, which actually means in the world, because of course some of those things don't exist anywhere else. So yeah, I think we're the only one in the world at the moment. So a quick sort of skate across some of this stuff. All projects and have to have a clear public benefit, has to be articulated, and they have to be low risk projects. There can't be any risk to participants' privacy, and that is assessed by an independent panel, which we provide the Secretariat for, but don't influence their decisions, with all sorts of experts on it. But importantly, about a third of the panel are members of the public. They make all the decisions about whether a project can go ahead or not. We also have a standing consumer panel. That's just people drawn from the public who sit and give us sage advice, and we go to for thoughts and wisdom when we're thinking about different things, and they can review projects, and they're fantastically useful group. We have a no data leaks policy, so data comes into the SAIL Databank. We can say quite clearly to a data owner that we will never produce a copy of it and send it out and lose track of it outside of our auspices. Researchers interact with the data by logging into our systems and getting that way we can trace every use. Researchers only access the data they need for as long as they need it, so we limit that. You may have got a sense of the richness of the data that SAIL holds, but actually virtually no given project will ever need all of that. So we give them a slice of that was necessary for the project that they wanted to do and no more, and we would give it to them for as long as they need and no more. We obviously require people to be competent, and we require them to do some fairly basic training on privacy and ethics and so forth as well. We adjust the data a bit as much as we can before the researcher gains access to it in our systems to make sure that it isn't more disclosive than it needs to be. And very importantly, any data that they, having done their analysis on our platform, want to take away and produce PowerPoint slides and publications and reports goes through a scrutiny process that we operate, and because they can't take it out of our system until we permit them, and so they drop them into a folder. We review them. If they're safe, privacy safe, and we use a whole bunch of algorithms for that, then they get forwarded on, and they can use them as they see fit, because we are confident that they are not privacy risk. I'm going to give you a little sense of how we do the anonymization. So all of the data in the SAIL Databank is de-identified, and we render it anonymous thereafter by our processing. But the initial de-identification we do in a standardized way, and there's a little video here I'm going to play you just so I get a moment to take a sip of tea, and hopefully this will work. And it very simply explains how our standard processing works. There you go. I hope that played all right for you. Quite simple. It's based on a principle called the separation principle, and it uses a organisation, third party, to do the individual linkage, but they don't ever gain any sensitive information about individuals. All they deal with is names and addresses, and we give them a very powerful box to do that. It's a very complicated probabilistic algorithm that has to run inside it to do that well. And the important thing about the processing that we do is that no organisation gains information about an individual that they aren't entitled to have. And the second is that processing that happens in what was called NWAS is now called Digital Health and Care Wales, same organisation. It means that it works in a standardised way. So when the machinery that they run for us spots the same person as it's seen before, it attributes the same unique identifying one that we've made up called ALF to that person. We don't ever know who that person is, but it does allow us to string those records together over time from the same organisation and from different organisations around the same anonymous person, and that's what allows us to build those rich longitudinal records that I spoke about before. It's easy to access. I mentioned before the processes that SAIL has in place. It makes it relatively straightforward to go on with expressing interest in accessing the data, and it goes through a proper scrutiny process. But it's well mapped, well trodden, and pretty efficient. I won't go into the detail. I mentioned before that we take public engagement involvement very seriously. We have a much bigger group than that now, a standing consumer panel, and they are intimately involved with all of our operations, through to the ultimate decision-making panel, which is deciding what data can be used for what purpose. We're also pretty clear with researchers that despite the fact that we are de-risking this data very significantly, they have obligations and duties, and we make them sign to that. We make sure that they are appropriately trained and cited on their responsibilities, and we also make sure that they don't have outputs as a result of their analytics that might threaten individual privacy. So we're a little bit tough on them, but I think they will agree, as we often ask them, that actually it's pretty painless, and once they get used to it, they can be very productive indeed. I won't go into this slide because it's very wordy, but just to say that we also, in addition to anonymizing people, we also anonymize properties, and that allows us to, under very carefully constrained conditions, look at anonymous households as part of research studies, and to see how individual household composition and the characteristics of those individual household compositions affect all manner of things. And as you might imagine, households are a very important entity. So how do we make this kind of work? We've been doing it for 12 years. Who pays? Good question. So we have some core support. We're very grateful to Welsh Government and their funding organisation, Health and Care Research Wales. They've funded us from the very beginning. It is a relatively modest grant, but they've kept it going all the way through, and it's been fantastic. We also get funded as core funding from the ESRC via ADR Wales. I mentioned that. I'll talk about that a little bit more in a moment. And we also managed to get funding from a whole wide variety of different programs that we're involved with, which all make a contribution to the cost of running the SAIL Databank, as well as doing specific research activities. And we also recover some funds through access charges for researchers. So we unfortunately aren't able to completely cover the running cost of the SAIL Databank and all its activities through the top two bullet points. So we do levy charges for researchers that wish to access the data. They vary enormously depending on how much help and support they need, because we don't charge for the data, we just charge for whatever services we need to levy in order that they get access to the data they want. And nine times out of 10, these researchers are writing these costs into a research grant somewhere and getting the funding. They're not always that way, but that's often the way it works. in terms of thinking about who pays for the data coming in, so we almost never ask a data owner to pay us to bring their data to the SAIL Databank, and I think that would be an enormous disincentive for them to do that. So sometimes that we'll try to just cover the costs if we can, and we're pretty good at bringing data to the SAIL, even though it can be quite hard work for a variety of reasons. And we'll do that sometimes when we know that the data set in question has got great utility, and the researchers of the UK or analysts of the UK will be clamouring to get it, and we can sort of recover the cost over time by charging them access to the data, so we don't have to charge the data owner to bring it in. Sometimes we don't have to do that. Sometimes we can cover the cost of bringing the data in under one of our initiatives, funded initiatives, these programs that I spoke about. And I've listed a couple there. I'll give you a sense of what they're about in a minute to give you that. Right, what else I can say? So we've got a lot of projects going on. We've got dashboards. I can show you all of the kind of quantities, but you can see it's a busy environment. Our systems are very busy, and around SAIL, there have been quite a lot of investments, many of which I've mentioned before, and spin-offs such as our security research platform that have kind of come about over the years and been very useful. So a couple of just pieces really about what we've been up to recently, and I just couldn't give you a talk like this without mentioning COVID, because it's been a big thing in everybody's lives for the last year or so. So up to the chase, I suppose, is that the SAIL Databank has become, for the country of Wales, the epicenter of data analytics to support governmental planning and monitoring. And on top of that, the agencies of Wales, government, NHS, have come together with the researchers here in Swansea and across Wales to create one team really working together to try and use data to support the analytics that COVID requires of us. And that's been extraordinarily successful. It's brought a lot more data, 27 new data sources we hurriedly brought into the SAIL Databank in order to support all that analytics. And indeed, some of it has come in a lot more frequently too. 123 new projects have been created, all COVID-focused ones, as a response to that. So a busy time for us, and the team back have been quite tired, if I'm honest. And a lot more data. Some of this data is now travelling to us, whereas it was perhaps monthly or quarterly before. It's now daily. That requires a lot of engineering. It's been very useful though in Wales, and some of my colleagues' geospatial modelling have been used by First Minister Mark Draper to go onto the press, onto the television, and show how the epidemic is spread across Wales using animated graphics. It's been nice to see and good to know that our efforts have been helpful. There's quite a lot of work on the shielded patients list at the beginning to understand how well that list represented those people that were really at need in the Welsh population. A lot of work recently, the latter part of the COVID epidemic, on care homes. SAIL was uniquely placed to understand where care homes were and who was in them, and whether or not staff and residents were at risk. We were the first, I think, to population level to talk about transmission within schools, the risk to teachers, the risk to students. Very topical for a while. There didn't seem to be any significant enhancements through the opening of schools before they did. We published early. We could see no heightened risk of clotting as a result of the vaccine use. So, all good work, I hope you'd agree. A couple of words about some of the national programs that we're involved in. ADI UK is a really important one, and ADR Wales is the bit that I lead, and it's linked to the SAIL Databank. This is a funded, ESRC funded program, long-term funding infrastructure, where we are trying to use governmental data, all the data that I might have mentioned previously, to the benefit of government decision making. So there's a team inside Welsh Government that works very closely with all of the different sectors of government in Welsh Government, and there's a team in SAIL Databank and academic analysts with them. And together we're executing a program, strategic impact programs, focused on children, on homelessness, on a whole variety of different topics. And the idea is that we find the data and do the studies that inform policy making and decision making, so that we have the maximum amount of impact. We want a real world effect, and the real world effect from data is only when someone uses data to make a decision. And so it's a very important long-standing program and very impactful, and we're very pleased to be part of that. In a similar vein, as we're part of HDR UK, Health Data Research UK, we lead the Wales and Northern Ireland substantive site. We're heavily involved in the National Core Studies programme, which is in support at a UK level of the COVID initiative, COVID response. Lots of research going on to try and help the UK be in the best possible place with regard to COVID and future epidemics. We're part of the ICODA International COVID Alliance, which SAIL Databank is custodying COVID-related data sets from all across the world coming in together so that researchers can analyse them together to help us understand, help them understand, the world understand COVID as it plays out internationally. And we're part of the Breathe Research Hub, which I'll say in a few words in a moment. The SAIL COVID work has been significant. If you go on our population data science website on Swansea University, you can see much of it encapsulated in clickable links. So if you're interested, that's all there. Another, just I think, a couple more national programs. Breathe is another initiative under which we are funded to try and make the world a better place in data terms. This time, Breathe is focused in on respiratory disease. So we're trying to accumulate the best possible respiratory disease from the NHS, from academia, and make it accessible, make it available, make it usable to improve the quality of respiratory research across the UK. So that's a really important initiative. This is another focused initiative. This one's different though, because this is about family justice. So this is really looking at, particularly focused on children who are in houses where there have been some form of breakdown and ended up as in the courts, either in the private law courts, disputed divorce, or in the public law courts where social services are intervening in a home, putting children into care and having them adopted and so forth. And so this is an area where there has been almost none and no analytical work on linked data ever. And therefore those people that are running the courts and making decisions and have little or no empirical evidence about what happens to people as they go through this. And so our job here, funded by the Nuffield Foundation and working with their family justice observatories, to try to accumulate the data, support the projects that will shed light on a really, really important social issue, and try and help steer what would be best for children and families going forward. I'm aware of some of the organisations that are on today. I couldn't complete this list of programs that we're involved with that UK-wide without talking about the MS register very briefly. So the multiple sclerosis register, funded longitudinally by the MS Society for many years, although it's now edging towards self-sustaining, is a platform where we do all the stuff, the data linkage things, getting data from clinics and from GPs and hospitals and so forth, linking it all together. But importantly, the one this is different is that we also have a platform where people with multiple sclerosis from across the UK, about 15,000 of them, donate their data periodically. They log into our systems and fill out questionnaires and forms and tell us about themselves, and we mix that data in with the other data we're getting from other places, and we present that as a research asset to those that are interested in multiple sclerosis, and that's been an extremely interesting, exciting project. Been going for about 10 years, and that portal facing patients has been extremely popular and continues to be so. Just a brief word on computing, because if you log into our system, what it does mean is that if you log in with your laptop, you could get a supercomputer behind it. So our systems provide the compute requirement that your project needs. So that could be quite modest if you're only using a little bit of data for your project. But actually, if you're really doing some hard numerical work with large data sets that want to build complicated models, we can provide huge scale compute for those purposes. So it's on demand. I'm going to get past that. So finally, I just want to say that our technical platform, which delivers that compute, that allows the SAIL team to do all the curation tasks, to manage all those researchers that want access, to manage all those projects, all of that stuff is a platform that we call SAIL, the Security Research Platform. And it was designed by my colleagues in the technical team initially to support operations of the SAIL Databank. But as time has gone on, we realised that actually there are a lot of organisations in this country and and internationally that want to do the same things that SAIL Databank does, but don't have tools or a platform to do it. And so we then separated the SAIL Databank from the platform and have made the platform available to others. And so this is where SERP comes in. It is just purposefully designed to do the sort of job that we do. It's been developed over time and continues to be developed all the time because SAIL has increasing demands and bright ideas, and they feed into that. It has a lot of important features, and I'm not going to read these out, but about knowledge sharing, code sharing, high performance computing, data quality measurement, data linkage, all of that are onboarded technology sets which are available to use at a click of the button. You don't have to be a programmer to use these. It creates the same secure environment, 27001 DEA accredited secure environment for a tenancy, which is what we call organisations that choose to use SERP independently of SAIL. They get the whole management console turned to them. They can do whatever they like with it, more or less, but they get all of the power of SERP at their disposal to do that and manage, curate, and share their data as they wish. As I mentioned before, it's very well accredited independently of SAIL, so that's very useful. And it comes with a whole suite of technologies which can be bolted on. You can do text analysis. You can use it to read free text documents and create structured data from them. All sorts of weird, wonderful stuff. You can use it for genomic data and imaging data as well. All part of a bundled suite of, I'm not going to go into that, that's text analysis. It also supports federation. So different tenants can, and indeed other organisations can, run their own secure environments, but they can interact with others and conduct studies between them, which is very much an important feature of our work as we move forward. And we're developing this particular technology significantly. I talked about linkage, and I talked about scale as well in terms of compute. I'm going to skip across these now. These are just a few screenshots of the way SERP deals with data sets and data assets, putting them on a catalogue so that you can see what's there, creating metadata catalogue entries so that people can see what's inside the data set and whether or not it makes sense to use it for a particular research study. And we're continually investing in new technology and new approaches to make it a seamless and powerful experience. We're doing this, and there's, I think it's about 30 different Organisations, independent as well, SAIL is one of them, that are using SERP across the UK for their own purposes of sharing their own data and supporting linkage. And there are also instances in Australia and in Canada too, where they are using it for the same sort of purposes. Again, independently of the SAIL Databank, but in not dissimilar kind of ways. So if you want any information about that SERP or indeed the SAIL Databank more generally, do not hesitate to get in touch. We'd be delighted to hear from you. So I think if I've judged right, we've got a couple of minutes, but literally a couple of minutes to spare. I don't know if there are any questions. There appear to be a couple in the question and answer thing. It's very weird talking to a silent screen. I'm used to conversation. So this is a bit, I feel a bit more comfortable now. So I can see Richard and Jennifer and I've asked a question, so I'm going to attempt to answer them in the last few minutes. Okay, so Richard asked, to what extent are you able to share with researchers the flaws, biases, and other issues that you mentioned that always exist in real-world data? Absolutely, and I hope I stress this enough. I think a lot of data owners get nervous about sharing their data because they're a bit nervous about the quality of their data, and they need to know everybody's real-world data, routine data, is a bit shabby. It's normal. Don't worry. But as Richard points out, it's really important that if you're a research user, you are informed as much as possible about the idiosyncrasies of a data set, so that you don't kind of fall into traps that others may have fallen into by assuming the data set's this and it doesn't. So what the SERP platform I just mentioned comes with tooling that allows that to be captured at a community level. So the way the SAIL Databank uses it has a thing called a concept library. This allows people to upload code and working definitions of things, and that makes it shareable to all of the research community that uses the SAIL platform, indeed the SAIL platform. There's other tools, wikis that you can use to have conversations about data, to ask questions of users, to share that kind of intelligence. So it's very important aspect, and we're continually looking to do that better. I hope that helps, Richard. I think I need to do this in the opposite order. Is any qualitative data included within the data sets? That's a really good question. Qualitative data is tricky in the sense that it needs to be more carefully processed when it's brought in to make sure that it's not intrinsically discursive, because obviously narrative data can say anything. So yes, there is. But it does require us to do a little bit more work at the point of it coming in to make sure that it doesn't inadvertently have people's names in there or references to other organizations, other people and stuff like that. It does. The other thing about quality data is that it often is quite small in terms of the number of people involved in it, especially if it's being purposefully collected in the survey. But, for example, lots of the national surveys in Wales and in the UK, we have the census, for example, from 2001 linked into the SAIL Databank. That's not what you'd call a qualitative data, but lots of that kind of data that might come from respondents is in SAIL. But yeah, perhaps it's less voluminous in that sense because of the number of rows that typically feature. Okay, so Christine, and this may have to be the last thing, share a bit more about the approval process. What concerns do especially citizen reviews have, and what projects get pushed back or rejected? Well, that's a really good question. I would say that we typically don't present a project that we know will be rejected to the panels because we've done work with the applicant beforehand to reduce that likelihood. It's no point in wasting people's time. Citizens are surprisingly keen to approve projects. They are. The more they learn about this world, the more frustrated they are that more is not being done to leverage the benefits from these data, and it hasn't been in the past. So they are supportive, but they are particularly sensitive, I think, about equity issues, making sure that subpopulations and individuals aren't sort of put at risk, aren't somehow inadvertently adversely affected through analysis. So they're vigilant about that. But generally speaking, I would say that actually they are generally very supportive, as long as they can see that the processes that we've put in place to protect privacy at all levels are being adhered to. And what they hate the most is if an application comes in and they can't see written clearly in plain English how this project will deliver a public benefit and be absolutely zero risk to the individuals to whom the data is made. If they can't see that written black and white, they get really cross, actually. So, I mean, part of our job is to try and work with applicants not to frustrate our citizens and reviewers. I hope that goes some way to answer your questions. I think we've run out of time. So I hope it hasn't been a terribly sterile experience. I hope it's been useful. The last thing to say is we are genuinely interested in helping if we can. And I think if any of you think that something we've got, either our technology or the SAIL Databank services or expertise, could in some way support you and your organisation, do not hesitate to give us drop me an email and we can have a talk. There we are. So thank you very much for putting up with me for the last 55 minutes. I think I pressed the button and we all. So it's been a pleasure. Maybe one day we'll meet in the real world. Who knows? Bye.